guys, welcome back to my channel. If you're new here, my name's Mariah. If you're not, hey. Today's video is gonna be one that I've been putting off until I really couldn't put it off anymore. Today is the day that I start radiation. We're gonna start from the beginning. Like, I'm not just gonna jump to the end, but I did kind of want to set the scene, and like the mindset that I'm currently in is like very like frazzled. I have to leave this house in like 20 minutes to go do my first radiation appointment. So I kind of just want to share with you guys what's been going on with me. Like, I know I've told my story about what's going on TikTok and Instagram, but I haven't actually made like a sit down YouTube video about it dedicated to what the hell is even about to start happening in my life. I don't know why I'm nervous. Like, I have so much anxiety about this. I don't know. So I'm gonna walk you guys through how I found out I had cancer, like what even led to that, and then tell you guys what this video is kind of gonna be about, or like the next steps, because I do want to go through this process with you guys. I want to like share my journey and have something to look back on, but also, like I said, share my journey. I've been doing it pretty well on TikTok and Instagram, but I have definitely neglected like the sit down intimate YouTube videos. Let's start in October. So October of 2024, I was very sick for about a week. I remember I started feeling sick on a Wednesday, and I told my boyfriend, like, I need you to come home because I just wasn't feeling my best. That entire week from Wednesday to Wednesday, I feel terrible. My dad comes to visit me. He already had a trip to come visit me out in California. We had a bunch of things that we wanted to do, and basically we kind of did them but kind of didn't, because I was just sick. I was sleeping like 12 hours a day. I wasn't eating. I was just sick. So I thought I had COVID or the flu or like a respiratory infection or something like that. And my dad's a fireman, so he's an EMT. So during the time that he was here, he kind of was just like watching me. It was fine. But on the second to last day that he was here, we went to the clinic. I did a respiratory infection test, negative. I did a flu test, negative. I did a COVID test, negative. All of them were negative. So I was just like, okay. They told me that I have a virus. When you have a virus, you can't really take an antibiotic because it's really just bacteria. You just kind of have to like sit it out. So I'm like, all right. 2 days after my dad leaves, I still feel like terrible. I'm getting worse. Like, you know, like eventually you start to get better. Like, you have like maybe a good day. I was having no good days. I was sleeping the entire day. I wasn't eating. I was throwing up. I had diarrhea, like nauseous. Couldn't make it down my stairs to even go get DoorDash. Like, just was feeling terrible. So he's finally like, you need to go to the ER. And my initial thought is like, you know how much the ER costs? Like, that's where my mind immediately went. I didn't even care about how sick I was. I was just like, I don't want that ER bill. Eventually he talked me into going. So we went to the ER. I remember it was a Thursday night. I could barely walk into the ER. I was so just like fatigued and just didn't have the energy. Like I said, I wasn't eating. So we go to the ER. They're trying to do blood work. I have no blood. They end up sticking me like 6 different times because I'm so dehydrated. So then I had to drink water. We had to try again. They had to bring out this machine to do an x-ray on my veins to find a vein. So they didn't even find like a good vein. They had to use a machine to do it. So once we finally get blood, they wanted to do like 3 vials of blood. We ended up getting half of one. They send it back for testing. Immediately they come back and tell me that I have pneumonia. They're like, you have pneumonia? I'm like, okay, to me that's good, because that means like I haven't been sick this whole time for no reason. Like, there is a reason I'm sick. Great. They also come back and tell me my D-dimer levels are extremely high. Mind you, I don't know what that means. My dad's on the phone, so he knows what that means. Basically, it like insinuates you might have blood clots. Apparently that's like a really terrible thing to have. I don't know anybody who's had blood clots. I'm thinking I'm going in there for them to tell me, oh, you have a bacteria, like some kind of virus or something. Like, I'm just like, even pneumonia, I was like, okay, I don't know what that is, but sure, great. So they're like, okay, we need to do I think it was a CT scan or an x-ray to look at your body. This whole time I'm like, okay, that's fine. When the results came back, they found out that I had a cystic mass on my heart. So like, I'm already very confused because the questions that they're asking me, like, do I have any difficulty breathing? Have I ever had a heart murmur? Has this ever, like, anything, has it indicated that you ever have had heart issues? I'm like, no, I was a college athlete. Like, I work out often. I feel fine. I came in here for you to treat me for this virus at the clinics that I had. You're talking about pneumonia already, and now you're talking about like a cyst. Like, no, I don't know what you're talking about. So they tell me I have this 10 centimeter cystic mass on my heart, and that I need to see a thoracic surgeon. I think that's the name of it, thoracic surgeon. So I go see the surgeon. He's looking at all my information, and he's like, this needs to be removed ASAP. Like, as soon as possible in the next month, 2 months max. My birthday is November 13th. I was turning 26, so I'm now 26, but all of this happened when I was 25. I had a trip with my mom planned. I had a birthday trip planned. Thanksgiving is coming up, Christmas is coming up. Like, I'm like, this is not a good time for me to be having surgery. But obviously, we had to do it. I feel like I'm telling this story so fast and I'm getting like winded and I'm getting anxious. And we end up doing the surgery the day after my birthday. My parents fly out here. So it's been like 2 weeks between the time I found out I had the cyst to the time that we decided to do the surgery the day after my birthday. Do the surgery, everything is like fine. Apparently this is a very common thing, not common in my age, but just a common cyst removal. It should be fine. The surgery should take about an hour, hour and a half. Like, you'll be able to eat afterwards. Recovery time will be very short, like you'll be fine. So I'm like, okay, great. I'm documenting my life on TikTok and Instagram, sharing what's going on. I wake up from the surgery. Mind you, my surgery was at like 1 p.m. I wake up at like 6 p.m. So I'm very confused on how the surgery ends up going from like an hour and a half to like 5 hours. Like, what happened? I wake up, I'm asking to eat. And my dad, I think I might insert some footage.
I see why they need to do the nose block though. I really don't want to breathe.
He did not do the nose.
He did it? Well, why is that?
He said he couldn't.
Why did you talk to him? Why did he do it? That's why?
What's wrong?
Because I can feel. I'm like,
That's why they can use it, baby.
I'm like, I am having difficulty breathing. So there's not a reason.
My dad is basically like giving me the runaround. Like, he's like, you can't eat. I'm like, why? They said I'd be able to. He's like, you just can't eat. We'll talk about it later. So I'm like, we'll talk about it later. What is there to talk about? Like, what is happening? As soon as my dad leaves the room, I'm like, Mom, what happened? Because something is wrong. Like, I woke up very late. They were supposed to also do, I don't know what it's called when they do, they like freeze your ribs so that you're numb for a few months after a surgery so that it's not difficult to breathe. If they don't do it and you're breathing after your surgery, like, you'll have pain and you won't be taking like full breaths. You won't recover as fast. So I'm like, I'm having pain. They're like, they didn't do it. They didn't do the freezing of my ribs. So I'm like, okay, I can't eat. It's 5 hours later and they didn't even do the freezing of my ribs, which they said was necessary. Like, it was a non-negotiable. What is happening? My mom basically told me like they found a tumor on your heart. So I'm just like, okay, that's alarming. A 10-centimeter tumor on my heart is very alarming for someone who a month ago was feeling fine, was working out almost every day. Like, this is just not really what I was expecting. From ER visit to surgery to tumor, it's like 3 weeks. So I'm like, okay, that's fine, but they got the tumor, right? Like, everything is good. Everything is good. In my mind, everything is good. He comes to my room the next day and is basically like, we're gonna send your tumor off to the lab. Send my tumor off to the lab for what? Like, what are we talking about? And he's like, to get tested for cancer. How have we gone from, I thought I had COVID, to pneumonia, to a cyst, to a tumor, to cancer, like in a matter of a month? Like, not what I was expecting at all. But again, I'm very positive about the situation. I don't know why, like, everything that I had found out up until this point was very negative. So I don't know how I was keeping like a positive mindset, but I was just like, there's no way. Like, there's no way that that's happening to me. There's just no way. There's definitely a way, because the test did come back positive. So they found out that the tumor was indeed cancerous. It is called thymoma. It is cancer in the thymus. To this day, I don't really know where the thymus is. I know it's like somewhere in the chest area, but couldn't tell you. I probably should know that, but I really couldn't tell you. Luckily for me, he did say this is thymoma type A, and he basically said if there was a cancer that you would want to have, obviously no one wants to have cancer, but if you were going to have cancer, this is the type of cancer you want. This is something that is treatable, not common in your age, but like, you're not about to die tomorrow. Even though he did say like, if we hadn't caught this tumor when we did and we had waited like 6 months, he would basically be telling me I have terminal cancer. So we are very like cutting it close in the range of, oh, your cancer is like not the worst, to no, you'd be dying. Like, what? Is that everything? I have so much anxiety right now. I don't know why. So I was able to see an oncologist Wednesday morning, and she recommended that I do radiation. Even though the tumor was removed, even though the tumor was cancerous and it was removed, they don't know for sure if I have cancerous cells in my body because they had to do the surgery. It was supposed to be laparoscopic, but he had to go in and like scrape some things off of my heart and off of my lungs. The chances of me still having cancerous cells in my body are very, very high. And if it's not treated, it'll probably come back, they said, in the next like 5 to 10 years. So we are doing radiation. They did tell me chemo is a little bit much. They basically said doing chemo would be like trying to nail a hole in the wall using a sledgehammer. Like, not necessary. Radiation will do the trick for now to like help avoid this happening again. Obviously, if it does come back, we'll address that later. But for now, radiation is what you need. Now that I've gone to the radiologist and we have a plan in place, I know that it's 31 sessions over the next 6 weeks. So that's 6 weeks and a day starting on January 27th. I'm not really sure how my body's gonna respond to radiation. I've talked to obviously the radiation doctor, and then I've talked to radiation patients. Everyone kind of has a very different experience. Like, some people are fatigued, some people are nauseous, some people were able to go to work every single day and didn't feel anything. The thing I'm most nervous about is I have very severe eczema. They let me know that basically you might have skin issues where we are radiating. So obviously they're radiating my chest, they're radiating my boob. They did say I might have like a little bit of itching, some blistering, maybe some swelling, some pain, and I'm just not looking forward to that being in my breast area. But yeah, today is day 1 of starting radiation. I think I'm gonna take you guys through like my first week of doing treatment and just see how that goes. They do say week 1 is like the easiest. Like, you'll start to feel it around week 2, week 3 is when your body will really start to feel the fatigue and the skin issues and everything. I'm hoping that they let me film in there. I've kind of like set the tone and let them know when I went back to do more blood work and stuff that like I am a content creator. I do want to share this journey and I do want to film this journey. So I'm hoping that they let me film something at least. So yeah, we're gonna go to my first radiation appointment. I'm gonna check in with you guys afterwards and let you know how it was, how I'm feeling, and then we'll go from there. Okay.
Yeah.
Are you able to see where the tumor was or no?
Yeah.
So you can see it now?
Mm-hmm.
Oh.
This machine is in megavolt for
Okay.
treatment, so it's without much energy it can go through the body and destroy the molecule of the DNA,
Okay.
so it doesn't grow, it doesn't divide anymore. Alright, we are done.
Really?
Yeah.
Good. Thank you.
Welcome.
It's really weird because you're in there and you don't feel anything. Like, it's just going around and around, and you can see like where it's radiating. Like, imagine like a magnifying light, but it's as it's moving the pixels in the light. I don't know how to explain it.
But you were saying
I know
it's
some
like
people
the
like
time probably went by really slow because
well, it
we're
didn't
just,
even
like,
go by
in
really slow. It's
silence.
just kind of boring. And I know some people like they let them play music or like listen to a podcast. So I'm gonna ask them tomorrow if I can do that. And then I had to buy this cream, Biafine, and I have to put it on 4 times a day. They said when I have morning appointments, what?
Damn.
Yeah, I know, it's a lot. When I have morning appointments, like at 8 a.m., they said don't put it on. And then they said when you have like noon appointments, most of my appointments will be at noon. They said put it on once as early as possible, and then the other 3 times do it like in the afternoon.
Right now, how are you feeling?
Like physically? Fine.
Okay.
I don't think I'll start feeling anything until like week 2
For a
or
couple
3.
weeks.
Yeah.
Yeah. Okay.
I think I have a headache, but I think it's just because I was so anxious.
Yeah.
As you guys can probably tell, it's the next day. But honestly, the appointment yesterday was very like anticlimactic. Like, after the fact, I texted all my friends and family and just let them know how I was doing. I don't know, like, it was just going into this tube, you don't feel anything, at least not yet. Like, I guess eventually you'll start, like I was telling you guys yesterday, having a little discomfort in that area. But during the actual treatment, I was just kind of bored, to be honest. So I'm gonna ask them today if I can like listen to music or maybe play a YouTube video in the background that I can listen to, just something to make the time go by a little faster. I was thinking like if I played 2 songs from the Wicked soundtrack, it should be over because it only takes 15 minutes. I don't know what time it is right now, but I know I have radiation every day starting at 11:45. They wanted it to be at the same time every single day, so it's very easy to like schedule other people's appointments, which makes a lot of sense if it's like something that's happening regularly for an extended amount of time and multiple people are doing it. So my appointments are gonna be at 11:45, which is perfect because there's no traffic, everyone's at work. So we're gonna head there now. Like I said, I'm gonna try and film. Fingers crossed that I'm able to. So it's my last day of radiation this week, and I kind of wanted to bring you guys with me because I feel like I've got it down to a routine. It takes less than 15 minutes, like I'm literally here for a total of probably 15 minutes. But I'm gonna walk you guys through how radiation goes. Good morning. 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 Hi. This is the room I come in to change. They always have clean gowns right here, so I'm gonna put one of these on. And I put my stuff in this locker. And because I get radiation on my chest area, I am allowed to leave my pants and shoes on. But I always have to take off my bra, obviously. Morning. I gotta get my music up.
Okay.
Listening to the Wicked soundtrack. There we go.
Want to stay until the end of the song?
You finished that first week.
Yeah, that's the whole week already.
And then I go back in this room to put my clothes back on. And they gave me this cream. I'm supposed to put it on 4 times a day. So I'm going to put it on for the first time today right now. My appointment was at 8:15 and it's 8:35 and I'm already done. Make sure I have all my stuff. Okay, let's go. So like I said, that's literally the entire process, and I'm actually really happy with the way that I handled this week because I feel like when the week started, I was very anxious and nervous. Now I'm back to like my positive mindset and just hoping for the best. I'm not gonna lie, it probably has something to do with my hair being done, but I'll take it. I'm gonna take whatever I can get. So week 1 of 6 is done. Yay! You guys can probably tell because my hair now looks a little bit different, but I haven't checked it in a while. By a while, I mean a week. Last week I brought you guys to my radiation appointment. I did have to film it on my phone because they said no to using this camera. So I tried to show you as much as I could have. Honestly, radiation has been very, very good. This Monday, so right now it is currently Tuesday. So yesterday was the first day that I felt, how would I put it? Yesterday was the first day that I felt tired, I guess. Like I left the appointment, I had a headache, I was very nauseous, but I kind of just let it ride its wave. I went about my day, I got lunch, like I just acted basically like nothing was wrong. And eventually nothing was wrong. It is raining so hard outside. I don't know if you guys can hear it, but it's like 2 o'clock and it's dark in here because it's been raining all day. Anywho, I went to radiation at 11:45 like I said, and it's been fine. I feel like I've got it down to a science. I feel like my routine of going is very like boom, 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 get in, get out. I am about to reapply my cream and then take my daily vitamins and probiotics, so we can do that together. So every day I've been doing a spoonful of the Coconut Cult probiotic coconut yogurt. I really like the strawberry flavor. I hate the coconut flavor, it's so nasty. And I'm not a huge vitamins person or like supplements person, but I started taking this vitamin C. I got it at Costco. I got this huge thing for like $8 just because I know vitamin C helps your immune system, and if my immune system is going to be weak, or if I'm already anticipating like feeling bad, I definitely want to combat that as much as I can. So this is the only vitamin I'm taking. If you guys have any recommendations for other vitamins that I should buy, let me know. I'm not like the biggest, I don't know a lot about taking vitamins. Let's go put on my Biofine or Biofine, however it's pronounced. I really don't know. And I actually looked up this cream the other day to see what it does, and it basically just helps with like sunburned skin, irritated skin, which is essentially what they said is going to happen to my skin. And the consistency of what it feels like to me is most like Nivea, like a watery lotion. It's not very thick. It's a very thin lotion and it spreads really easily. So I always try to do this in the same shirt so I'm not ruining multiple shirts. This is like my normal sleep shirt that I always wear. So then I just rub it all over my chest area, and the radiation is on my back. It's literally all over this entire section, so I also have to do my back. So that's literally how my days have been looking. Very positive, very good. I do want to continue with this vlog at least for 2 weeks just to see if I feel any differently by the end of this week. Like I said, it's Tuesday, so we obviously have 3 more days of treatment, and then we have the Galentine's Day vlog. I'm doing a Galentine's staycation with my friend and then some of her friends. It's kind of like a birthday trip, Galentine's Day trip combined, and I'm super excited about it. I'm hoping that it doesn't hit me this weekend and I'm super drained and can't do anything, because that would be annoying. But yeah, I'm gonna check in with you guys tomorrow or the day after that, and then I'll update you on how I'm feeling. Good morning, you guys. I'm about to head to my Thursday radiation appointment, and I was thinking that I could bring you. Thursdays is usually the day that the doctor talks to all of the patients. So usually when I do radiation, it's just like a normal, the closest term I could think of would be like a nurse. He doesn't actually do my treatments day to day. I just see him on Thursdays to like talk through how I'm feeling and everything, and I guess do a checkup. Last week I missed it because I didn't know that I had it. So I had another appointment that I had to go to. So this week is gonna be my first one. So radiation and everything will be the same, and then afterwards we'll meet with the doctor. I'm really hoping that I'm able to film it. I'm gonna let him know like, hey, I'm just wanting to document my journey. I won't film you, I won't record you, but can I film this appointment? I'm really hoping that he says yes. But in other news, do you guys see this coat? I got this from, who is calling me? My best friend. I got this coat from ASOS. They just sent it to me, and it's like a long trench coat. It literally goes down to almost the floor on me. Love that. I also just made myself a little matcha. I've been really obsessed with Philz lately. Their Honey Haze iced coffee, and I'm trying to not spend $6 every day on coffee when I literally have a coffee maker, a matcha station, like everything at home. Okay, I think I'm ready, so we're gonna head out. I'm bringing my book because last week when I went, I was gonna stay for the Thursday standing appointment, but it was just taking so long, and there was like 5 other people before me, and I had already waited 20 minutes after my appointment, and I had to go. So I know there might be like a little bit of a wait, so I'm gonna bring my book. Like I said, have my matcha, and we're going. I will say the thing I appreciate about this office is that everyone is very, very nice. Like there's no one in here that's my age. I haven't seen like a 20-year-old in here ever. But all of the people are so nice. I haven't like had to advocate for myself or say like, hey, I think we're doing this wrong, or I need this and I haven't gotten it. I like this office a lot. Like I'm thinking one day I might bring them, I don't know, maybe not donuts, like maybe donuts, I don't know, something. Because I feel like they're just taking care of me really well, and I appreciate it a lot. Okay, gown is on. Let me pick my music. I think I'm gonna do Tim's. Okay, let's go. Okay, treatment went good. It is currently 12:02, so like I said, it goes really, really fast. I'm just waiting to see the doctor. I do want to talk to them about like an oncologist situation, because I need to find a new one. The one that I was going to is not covered by my new 2025 insurance. Maybe they'll tell me something, like something new or something that I should be doing to help, but I'm feeling good.
But walking is good for you. Exercise.
Okay, I've been working out every day.
Yeah, good for you. Later on, you might feel like walking out every day. Usually you walk an hour, maybe 40 minutes, 45 minutes. You
Okay.
feel tired, which is normal.
Okay,
And you might feel like you want to sleep early,
go to sleep earlier? Okay.
which is normal. So you've been posting on your,
Yeah.
people follow you, and what do they say?
They're just like wishing me good, like wishing me well and stuff like that.
Can I take a look on your,
Yeah.
to see how you said your skin changed?
Do you feel like anything?
No, it hasn't changed yet. Probably you just started last week. So this time you have about almost
End of 2 weeks, yeah.
You feel tired?
No. I had a day on Monday where I did, but not really.
Someday you feel up and
Yeah.
down, and which is normal. How's your eating?
Normal.
Any hurting on your throat yet?
No. So that's another thing. She's not covered by my insurance, so I need to find a new oncologist.
Call your entrance to see who.
I went to one in, I have to get her name. I did not like her. She basically told me I didn't need to do radiation. She was like, this is not that serious. And then she was like, I'm gonna point you to the cancerinstitute.org, like the Cancer Society website. And it was just, I don't know, I didn't really go
What did Dr. Lee tell you?
to do radiation.
Any chemo at all?
No.
Okay.
And then she said she would meet with me afterwards. I'm trying to find the name of the lady I went to.
She's about 60-ish,
Yeah,
70.
really short.
Yeah,
Yeah.
yeah.
I didn't love.
The
So I
way
need-
she presented you.
Yeah. She was just like, this is not a big deal. This is not a rush. I was just like, well, I just had heart surgery a month ago. And she was like, yeah, it's not a big deal. It's like, okay.
Okay. come over here if you don't mind.
Okay.
So how's treatment going for you?
It's going really good. I haven't
That's
had like
great.
anything crazy start to happen.
Fantastic. So no real pain, no, and you shouldn't really.
You know, honestly, you're too young to be in here.
Yeah.
And that's part of the thing that I just want you to know that. But you certainly are not the youngest.
Okay.
The youngest we have had was 23-year-old. But what you have is like a different, you know, a different. You have a thymoma
Yeah.
and shit, right? Breast cancer.
Yeah.
It's all good. We're trying to protect you here from this thing coming back.
Okay.
And you're doing fine. Any difficulty swallowing, anything like that? Okay. Now I'm gonna tell you in about in a week and a half, you may experience something like when you swallow some food, you may feel like it's kind of when it goes down, it kind of like hurts. Or
Okay.
let us know.
Okay.
As soon as that happens. Everything on your treatment is going good. Your vital signs are good. Everything's good. Weight is good. X-rays are good. Everything is doing okay. Now, I don't know. We would like to listen to your heart and lungs. You don't need to take this too far down, but just a little bit.
Okay.
Right there. Okay. Are you putting the lotion on?
Yes.
That we do. Okay. How many times a day?
I was told 4.
Good. Just
I'm
keep that
doing
going.
it like 2, 3, 4. The minimum I've done is 2, but I'm trying to get to 4.
Thank you.
Yes.
We're just going to continue going, and I hope throughout this whole thing, this will be as easy for you as
So
we
far
can
it
make
has
it.
been. It has been really good. I'm so annoyed because I knew I had another camera battery and I literally could not find it in my purse, but I found it when I got to my car. But as you guys saw, my appointment with Tree, the nurse, and then with the doctor went really, really well. I feel good, like I told them. I think next week is when I'll really start feeling it, like they said, like the struggling with the eating and the tiredness and then like the discoloration. They examined what my breasts look like and everything looks fine in terms of the coloring. I feel like I can personally tell my boobs are getting like the slightest bit darker, like not noticeable to anybody else but noticeable to me. But it's also really weird because he like just casually threw out like, oh, this is technically breast cancer. I know it's really technically not, but it is like a cancer that was on my heart. It's just like weird. I don't know, hearing it and then hearing it applied in my situation just sounds not possible. As you guys heard, I did tell the nurse about my experience with an oncologist that I met with a few weeks ago. I did not like the energy and the vibe that I got from her. I felt like she was diminishing what I was going through and the seriousness of the situation, especially as someone who's this age. Like she was just like, oh, you're healthy, like it's fine. What does that mean? Like, what does that mean? So I'm still in the hunt for a new oncologist. So I'm gonna call my parents, let them know how the meeting went. I think I'm gonna end the vlog here because like I said, like I have one more treatment tomorrow and this is my only meeting with the doctor. I'm assuming that tomorrow's treatment is gonna go the way that the other treatments have. So I really hope you guys like this video. I hope it was informative and not too much of like a drag. I try to be as positive as possible. I'm feeling very positive, so I really hope that that comes through on camera. Like always, I appreciate the support. I appreciate the well wishes that everyone is sending me. I'm hoping for the best. I know everyone else is hoping for the best. And yeah, I will see you guys in my next video. Bye. And yeah, I will see you guys in my next video. Bye.